right now, and so we are going to get started. Dr. Graham, the screen and the microphone is yours.
Great, thank you, Stacy. Yeah, this was sort of a last minute kind of thing, and I think the original impetus was to speak with House Rabbit Society on shelter recommendations. So I do have the most recent documents, as far as I'm aware, from HRS about this. And I'm going to be doing an overview of the disease to start with. I'm going to be going through the handouts, which Stacy is going to be emailing out to everybody. And for those that know me, I sent out an email with the attachments, but if you didn't get it, just let me know and I can send it out. Feel free to ask questions as we're going along. I'm going to just go over the disease a little bit on the handouts, and then have some time for questions. So if you do, I guess, Stacy, maybe the easiest thing is if people type it in the chat and then you can just let me know. I think that I have done enough Zoom now that I can hopefully do this. So can you see the Rhdv2 update for shelter veterinarians? And I will keep in mind that it sounds like not everybody is a veterinarian, and so I apologize, there may be a gross picture, but it's good to realize how serious this issue is. So this picture is one that was recently, I don't know how many of you have access to the Veterinary Information Network, but that had a really good recent article that summarized the hemorrhagic disease outbreak and the current situation. And it's one of the better informative pieces of material I've seen. So I just wanted to mention that for those of you who have that access. But I took this picture from there, and unfortunately, this may be what you see. You may see a rabbit that's completely normal without any sort of signs, and then find it looking like this. So one of the things I do want to emphasize is if you have any rabbit deaths and you see hemorrhage associated with those deaths, it's very important to notify. Well, I would say we're going to emphasize notifying a state vet, but it's really just, I think, a matter of time until this is reaching us. So this is more of a sort of a preemptive overview, so you can be prepared for this. So this is a calicivirus, and we'll talk a little bit about disinfection as it relates to that. But you can, in terms of a lot of the ways you handle it, in terms of disinfection, a lot of the same concepts with rabbit calicivirus, cat calicivirus will apply. So this disease was first diagnosed in China, and it was thought that it was probably originating from Europe, and then has subsequently spread. It was introduced in Australia and New Zealand as population control, partly because the populations were just getting out of control. And as these things tend to do, sometimes they end up in other places not necessarily intended for them to go. There's three forms of the virus, and so Rhdv, Rhdv-A, and Rhdv2. And the one that's going on right now in this country is Rhdv2. So just to let you know that. And we'll talk a little bit about how these strains are a little different. So just a couple of important things to talk about from the beginning. This is not a zoonotic disease, so you don't need to worry about it infecting humans. Unfortunately, this is not a treatable disease. As a virus, oftentimes the viral diseases are not treatable. This is not going to be a threat to human health. So I do get that question pretty often. Do they, do we have to worry about that? But it is a reportable disease. And so that's something that I'll mention several times, is we definitely want to keep on top of this and know if it's in the area. So one of the tricky parts about this disease is it's currently classified as a foreign animal disease in the United States, and as such, there's a lot of legislation around that in terms of particularly obtaining vaccines. So we'll talk a little bit about that a little bit later on. But at this point in time, it is rapidly becoming endemic, and so it's been reported in quite a few states. And there have been sporadic outbreaks over time, and actually, again, I'm going to be on my soapbox for about a minute and then I'll get off. But the recent outbreak in New York City, actually, I don't remember what I was doing, but I was not, I think I was having fun on the weekend or something, and I got a random text from one of my previous students, and he said, oh yeah, I was working on this rabbit and then it died, and then I've had like 3 or 4 more die, and now I'm seeing some that look like they're going to die. And I was like, hey, call the state vet right now. And it turned out that that's what this was, it was hemorrhagic disease virus. So again, just to emphasize, if you are concerned, you want to get the state vet looped in ASAP because they're able to get rapid diagnostics. And if you're waiting for necropsies to come back and things like that, it's going to be too late. So just make sure that you do not hesitate. They are now aware of this being an issue. So don't hesitate if you see anything that's a little suspect. But the big concern with this is that while previously thought not to infect wild rabbits, it is infecting wild rabbits. And so that's the big problem here is with it becoming established in wild rabbit populations, there's easily going to be crossover. The virus can easily be transmitted. And so unfortunately, now that we're seeing it in wild rabbits, there's really no way to stop it from progressing. Whereas before, if we just had sporadic outbreaks here and there, they could be more easily controlled. But that's not going to be the case anymore. And so that's why this is particularly scary. So I mentioned about you may just have a rabbit die, and that's often what happens. Usually these signs are going to happen 9 days after exposure. Incubation is going to be between 3 to 9 days. And so sudden unexpected death in previously healthy rabbits. And the reason this happens is it causes necrotizing hepatitis and splenitis. So what that means is you've got a sudden die-off of the liver and spleen tissues. And when that happens, you can just have a massive, essentially cascade of events that happen in the body that result in death. But it happens so quickly, and that's the problem in terms of ever knowing if we're dealing with this from the beginning. So for those rabbits that don't die immediately, some of the things that you may see is just really like low activity level. Really pay attention on if a rabbit has a fever. And so for sure, being familiar with how to take a rabbit's body temperature accurately. And I would mention for those of you that haven't done it, there's a fun little YouTube video with Amy Sedaris and the House Rabbit Society that goes over how to get a body temperature on a rabbit. Because it actually is a little tricky, and sometimes we see like the first spot you see when you're looking at the rabbit's underside in that region is actually going to be the vulva or prepuce, and some people mistakenly try to temp that area. And so just even being able to get a good body temperature is going to be helpful. And then really one of the big keys on this is hemorrhage. And you may, unfortunately, you may not see hemorrhage, but if you're seeing any sort of hemorrhage, especially from the nose, you want to pay close attention to that. If you see redness around the eyes, so the conjunctiva of the eyes, if that seems red to you, that should also be a concern. And then for these rabbits that don't die immediately, thinking about the types of effects that can happen when you've got massive splenic and hepatic death, these guys are going to have jaundice, so the yellowish coloration to the skin, indicating that the liver is not in a happy place. You can have respiratory distress, particularly if you have bleeding into the lungs. They may have GI signs, so things like diarrhea or weight loss or bloating, things that you might see with a lot of other conditions in rabbits. But then ultimately you may see bleeding and death that occurs. So the good thing is that this particular strain that we're dealing with, it's not as lethal as Rhdv. So in terms of mortality, for the Rhdv and Rhdva, mortality is 40 to 100%. So that is astronomical. When we're dealing with these infectious diseases, that's not good news. And then you can see quite a range, 5% to 70%. It's quite a range. So unfortunately, that can make things a little bit more tricky when it comes to things like asymptomatic carriers, which we'll talk about. And for places where rabbits have survived the disease, people have described the rabbits just being limp for a couple of days and then coming out of it. But the problem then is rabbits can be subclinical for disease and they can shed for months. And that's where one of the big problems comes in with this, is you can have a rabbit that looks perfectly normal and it may be shedding virus. Sound familiar? Sort of like COVID. Interesting that it happened kind of around the same time. So this is another sucky part, is transmission. So it's very easily spread and very contagious. So some of the ways that this can be spread, ingestion of contaminated food or water. So that's important to think about if you have rabbits that are sharing food or water bowls, or if they're being mixed between areas where rabbits are kept. Any sort of direct contact, whether it be an infected live rabbit or a deceased rabbit, is going to be a concern. And so even something like somebody going out into the woods, finding a dead rabbit, potentially handling it, they could then bring the virus home. And actually, I'll digress just briefly. One of the outbreaks that occurred was actually from, there was a woman who had rabbits, but she was able to carry the disease, but she worked at a restaurant that served rabbit. And just in preparing the meat at the restaurant, she brought it home to her rabbits. So it is very transmissible with that sort of contact. It can be transmitted via inhalation, also with any sort of contaminated equipment or hutches or tools or bedding. So again, you could see where this could become very quickly a disaster in a shelter type of setting. Also, we have to think about insect control, because it can be spread by way of flies or insects, scavengers, humans. So pretty much anything can be a mechanical vector for this. Any contact with urine, feces, or respiratory discharges of infected rabbits can also spread this. And so then again, we run into the problem where if it's endemic in wild rabbit populations, a lot of times we have people that have their rabbits that spend time outdoors. Maybe they're grazing in an area where a wild rabbit has been, and so they could easily pick this up from the environment if there have been infected rabbits in the area. And then again, with just the secretions, that will shed virus, and so then anything that could potentially transmit that, whether it be dust or flies, can transmit this. Even contact from feces from predators that have ingested infected rabbits. And so that's unfortunate, because these wild rabbits may be much easier to catch, and so then it could be transmitted potentially even in that way. So control, as you can imagine from that, it's going to be challenging. And in terms of viral stability, it can live in flies for 9 days, in carcasses for 3 months, and for several weeks in secretions and excretions. So it's really tough in terms of trying to control it. And it can be viable in the environment for 105 days at room temperature, 225 days at 39 degrees Fahrenheit. It's not killed by freezing and can survive 122 degrees Fahrenheit for 1 hour. So I'm not telling you anything good, I'm sorry. All this is bad. And then rabbits who survive may shed virus for 30 to 105 days, at least from what we know at this point in time. Permanent shedding is unlikely, but we don't know for sure about all of this. There's still a lot to learn. And then immunity, it's unknown. We suspect there may be some immunity, but in terms of what amount of time, we're not sure. So again, a lot like COVID. So there are vaccines that exist for these. Things to keep in mind is that because they're different strains, the vaccine does not cross-protect between strains, which again makes it very important to work with the state vet, because depending on what strains you're dealing with, that would indicate what vaccine you need to use. Again, in the country right now, Rhdv2 is what we're dealing with. And in places where vaccine is recommended, then annual vaccine is recommended according to manufacturer instructions. So the big issue with this is there's not a vaccine available for use in the United States. And because this is still considered a foreign animal disease, I've been talking with USDA and state vets about it, and right now we're very restricted in terms of even obtaining the vaccine. So in terms of getting vaccine, you have to coordinate it through the state vet and through USDA. And as of right now, they're only allowing it in states where there have been reported cases. So right now in Massachusetts, we are not at the stage where we can get vaccine until this becomes declassified as a foreign animal disease. So that's the big push right now, is to try to get it declassified so that we can get vaccine in the US. That will make things much easier. So I just actually talked to a friend not 10 minutes ago, asking him for an update that's in Arizona. And what had happened is when the cases were first starting there, he had spoken with the state vet, coordinated with USDA to get vaccine imported. And what happens is when they're actually getting the vaccine, they essentially make it as it's ordered, in part because it has a very short shelf life. And so he placed the order and they said, okay, well, we'll get it to you in a month. Well, this right around now, he said, I'll get it at the beginning of June. So I reached out and I said, have you received your vaccine? And he said, well, yeah, I did, but it was held up in customs, not refrigerated, for 4 days. And so now they have to, I put in a reorder. So because it needs to be refrigerated. So that's a problem. And then also the cost. So one of my other friends that ordered it, she said that she paid $8,000 for only 500 doses of vaccine. And part of that is with trying to get it into the US, you need to have customs broker that then you have to pay. And then again, with the short shelf life, this is problematic because unless you plan to vaccinate 500 rabbits at once, then people are hesitant to order it because you're going to lose money. Now, in talking with our pharmacist and what's happening right now, I think the best bet is going to be to have a point person to obtain vaccine and then potentially distribute it. That will be the easiest way to make this cost effective. So as this is ongoing, we'll have more information about the potential for that. The vaccines that are available, and I will be sending you the handouts that Stacey's going to email, has some specific info about the vaccines. But there is a vaccine in Spain and a vaccine in France. And just to be aware of some of the controversy around this, I mentioned it earlier, but if you do talk to someone from HRS has been strongly pushing to not use this particular vaccine. And the problem is there is another vaccine that is combined with myxomatosis that is another vaccine option, and that does not require sacrifice of live rabbits. But the problem with that vaccine is with the myxomatosis, it's a modified live virus. Myxomatosis is also a foreign animal disease in the States, and USDA will not approve the use of that vaccine because there's the potential of causing disease. And so right now, with this, be aware there is some controversy because there are some live rabbits sacrificed. I did get the details. I have them in an email somewhere, and it's not a huge number, but it still is something that HRS is very opposed to. However, because of the difficulties of getting vaccine right now, our hands are tied in terms of what we can actually use. The onset of immunity is considered to be a week post-vaccination. I had mentioned about the annual booster. Now, the problem with this is there have been reports of rabbits that have died that have been vaccinated. So nothing's 100% effective, and this vaccine is not 100% effective. I have not yet heard of efficacy studies to be able to give you a percentage, but I would say certainly it's better to be vaccinated than not. And in terms of efforts underway in the US, unfortunately, it's likely we're going to be at least a year away from having a vaccine. So unfortunately, this headache is going to be for some time, I suspect. So in terms of biosecurity practices, when you see the handout from HRS, they have some biosecurity practices recommended for if it's endemic in the area and you have access to a vaccine, or if it's endemic in the area and you do not have a vaccine. So there's a couple of different plans in place. But if it's in your area, what HRS is going to be planning to do is in the areas where it's being reported is to try to get rabbits into adoptive or foster homes to minimize contact to other rabbits. And they're being pretty strict in terms of their recommendations, and they're actually recommending that the rabbits go to a home without another rabbit. So you can imagine this is going to be challenging because a lot of our fosters have multiple rabbits. And so that does complicate the issue because anyone who takes a rabbit of unknown origin into their home when it's endemic potentially runs the risk of introducing it to the other rabbit. So it is a little bit of a complicated issue. I mentioned about feline calicivirus. You can disinfect in a similar fashion. So follow the label instructions on what you're using. And as is usually recommended, you want to mechanically remove surface debris. And then I listed a few things that are effective against the virus commonly used in shelters. So that's at least something helpful to know. And the recommendation they have is you want to limit shelter to shelter transfers or shelter to rescue transfers. Obviously, the more that rabbits are going back and forth, the more potential there is to introduce this. And if there is a quarantine order in the area, no rabbits may enter or exit. And that's something that's going to be mandated anyway, but be aware of that. Also, there can be no transfers to or from areas or shelters with confirmed disease. And again, you'll see, I'm not going to go into the guidelines in great depth, but just to say that with overall, if these rabbits are being handled in shelters or in individual homes even, PPE is recommended to try to minimize any sort of distribution of viral particles. Separate clothes worn outside to decrease the potential of bringing things in. Any rabbit that comes in, if you have a 14-day quarantine, that should cover that 3 to 9 day incubation period. So if a rabbit was going to start showing signs, then hopefully it would be within that time. But then when you introduce the potential for asymptomatic shudders, that's where it gets a little bit more of a gray area. Insect control is important because it can be transmitted by way of insects, and so we need to keep that in mind. And then also, even in terms of item storage, if items are stored in areas with rabbits, then it could potentially be transmitted. There's even been concern about hay sources. So if hay is coming from an area where there are rabbits that are infected, the potential to introduce it is concerning. The recommendation also is if you're in an area that has this disease, you don't want to take donations from rabbit owners, and quite a few other things. And so I'll introduce you to those documents in just a minute. And I will provide this PowerPoint to folks after the fact so that you can follow this link. Oxbow Animal Health is doing some blogs on this, and a lot of the kind of current updates are being listed there. So that's a helpful resource in terms of seeing some video on that. And then this is just an example of what is going out to the public in terms of protecting rabbits from this disease. And one of the things that's a little bit interesting to consider is about plants, greens, tree branches, because a lot of times people will bring things in from the outside, different tree branches for environmental enrichment, things like that. But if you do have it being shed by the wild rabbits, then potentially we could be introducing it that way. Flea treatment is going to be something to have in the back of your mind. And just a reminder that frontline should never be used in a rabbit. It will kill them. And so things like Advantage, Cevamectin, those are okay, but you want to be careful about what you use, even in way of parasite control. So generally things that are safe for cats, excluding frontline, obviously, you may be able to use on rabbits, but be very cautious that a lot of the products available, particularly when we think about things like cats being susceptible to problems from dog products, same sort of thing. Rabbits are even more sensitive than cats are. So let me really quick bring up the, can you see this recommended rabbit standard operating procedure? No, you can't. Let me share the screen again. Okay. Can you see the document here that's, okay. So this is one that I'm going to distribute, or we'll make sure that you have it if you haven't already seen it. But again, this is from House Rabbit Society in terms of recommendations for shelters or rescue facilities that are dealing with this in their state. So it goes over the disease, gives a good background so that you have information on that. It gives some good resources on this disease. So it'll be some good resources for this sort of thing. And again, a lot of this I have already discussed, but it goes into a little bit more detail in terms of how it's transmitted, even, cars coming in and out. We have to think about even things like that. And then fortunately, there's some information from Dr. Harcourt Brown, who's dealt with this a lot more, who has some survey information on what's happened. It goes through a little bit more specifically in terms of disinfection protocols. So this is very helpful to know about if you will be handling rabbits. And then disinfection of surfaces anywhere where a rabbit has been. One thing I did want to point out is that if there is, if the shelters are offering any sort of boarding, grooming, nail trimming, things like that, where rabbits would be coming in and out, it's better to not do those things. And I'm saying all this preemptively. I don't know when it will arrive in this area. So all of this is assuming that it, when it's actually in the state, when it's in the area. But this is the sort of thing that you would not want to do. I mentioned about limiting the shelter-to-shelter transfers, talking about the ways to handle carriers, and then, intake sort of things. So it goes through things in a lot of detail. So that'll be the most helpful and most thorough for you to consult. And then in addition to this handout, the other one that I have is on the vaccine. So this one actually goes through the vaccine, gives you some links, talks about, the different requirements for this. But again, it's tricky because without having the state vet involvement, you're not going to be able to get this. So we'll see as things progress. I just worry that it's going to take, as of right now, it'll take the disease being reported to then have this be something where we can even begin the possibility of getting the virus and the vaccine. As I mentioned before, it's fraught with some complications to get it. So I'm sorry to give you bad news, but it's better to be prepared and know about this before it gets here. And so,
Excellent.
all right.
Well, thank you so much, Dr. Graham. And we have a few minutes for questions. If there are any folks that have any questions, if you can put them in the chat, I am gonna do that here. We have a large group. So in the past, I would normally have said, unmute yourself and just chime up, but like, I'm just trying to be careful here. Somebody's
and actually one thing that because I'm looking at the note,
okay.
I'm looking at the note from Michelle, and I guess I would say I may get in trouble because I was talking about the controversy in HRS, so I feel like I'm a little nervous with it getting out there because that's been recorded for all eternity. But it is something that I think is very important for veterinarians to realize, because there is, that is something that keeping in mind in terms of being aware that rabbits are sacrificed for this vaccine. I think it's important to know, but hopefully HRS will forgive me for bringing up this sensitive topic, but I felt like people needed to know. So if you have people asking you.
Sounds great. Excellent. Then we have Shirley here asking about the Chinese herb, Yunnan Bio, that's used for dogs who bleed out from.
Yeah, too little too late. There's no way is going to be my guess, because when you have acute hepatic and splenic necrosis, and I guess I would say I cannot say with 100% certainty, and I certainly have heard a lot of good things about this with other situations where an animal would have hemorrhage, but when you have a massive, like a acute DIC sort of scenario, it's not going to stop that, unfortunately.
Great. Excellent. All right. Well, it looks like everybody is, I've gotten lots of requests for the recording and for the handout, so I'll make sure I get those all sent out to folks. I think it was a great 30-minute overview on the whole situation, going from sort of the medical side to what you know on the sheltering side. And it definitely sounds like there's some challenges there. It sounds like that vaccine conversation is going to be an important conversation at the Massachusetts level, because I would assume some organizations maybe only take in like 20 or 30 bunny rabbits in a year or something like that. So might have to be some collective efforts there.
And I noticed there is a question about
Yep.
cross-contamination with other species. So it's not going to infect other species beyond rabbits, but the problem is cross-contamination, yes, from the sense of a mechanical vector, and even in an animal eating a rabbit and then defecating, it's spread that way. So I guess the technical answer is yes, cross-contamination is going to occur with other species that come in contact with rabbit carcasses or infected rabbit excretions.
Great. Excellent. All right, Dr. Graham, well, thank you so much for your time. And again, thank you, Dr. McCobb, Emily McCobb out there, for introducing us and bringing you to our Mass Animal Welfare Call here at, it's always at noon on Thursdays every week. We started when the coronavirus hit. So we're always here at noon on Thursdays. So thank you again, really appreciate it. And you've become our bunny rabbit expert. So.
All right, thanks so much, Stacey. I'll talk to
Thank
you later.
you. Yeah.